PSC NURSE പുതിയ വീഡിയോയിലേക്ക് സ്വാഗതം. മെഡിക്കൽ സർജിക്കൽ നഴ്സിംഗിൽ ഗ്യാസ്ട്രോഇൻറ്റസ്റ്റൈനൽ സിസ്റ്റം പാർട്ട് 2 40 ചോദ്യങ്ങളും അവയുടെ ഉത്തരങ്ങളും ഈ വീഡിയോയിൽ ഉൾപ്പെടുത്തിയിരിക്കുന്നു. വീഡിയോ ഇഷ്ടപ്പെടുന്നവർ ലൈക്ക് ചെയ്യുകയും അല്ലാത്തവർ ഡിസ്ലൈക്ക് ചെയ്യുകയും ചെയ്യുക. വീഡിയോ കാണുന്നവർ സബ്സ്ക്രൈബ് ചെയ്യുകയും നിങ്ങളുടെ വിലയേറിയ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുകയും ഫ്രണ്ട്സിന് ഈ ചാനൽ ഷെയർ ചെയ്യുകയും ചെയ്യുക. സബ്സ്ക്രൈബ് ചെയ്യുന്നതോടൊപ്പം ബെല്ലൈക്കൺ ക്ലിക്ക് ചെയ്താൽ ഞങ്ങളുടെ വീഡിയോ അപ്ലോഡ് ചെയ്യുമ്പോൾ അപ്പോൾ തന്നെ നിങ്ങൾക്ക് ലഭ്യമാകുന്നതായിരിക്കും. നമുക്ക് വീഡിയോയിലേക്ക് കടക്കാം. The type of gastritis presenting with red and edematous mucosa with small erosions and hemorrhage is called dash. Superficial gastritis. The type of gastritis involving all layers of stomach, usually associated with gastric ulcer and gastric cancer, presenting with less number of parietal and chief cells, is called as dash. Atrophic gastritis. The type of gastritis that produce dull and nodular mucosa with irregular thickened or nodular rugae and hemorrhage is dash. Hypertrophic gastritis. The procedure done to relieve the pressure caused by the contents and gases that remain in the stomach or bowel due to obstruction is called as dash. Decompression. The irrigation or washing out of stomach is called dash. Gastric lavage. The process of giving fluids or nutrients via a tube when the oral intake is inadequate is called gastric gavage. The single lumen short tube used to remove fluid or gas or to obtain a specimen of gastric contents is dash. Levin tube. The double lumen short tube used to decompress the stomach is Salem-Sum tube. The most common type of esophageal diverticulum is Senker's diverticulum or esophageal pulsion. Candidiasis commonly seen in immunosuppressed patients is caused by yeast-like fungi called dash. Candida albicans. The painful sensation of warmth burning in the lower retrosternal midline that is resulting from abnormalities of lower esophageal sphincter is called dash. Heartburn or pyorrhosis. The surgical management of achalasia where our incision is made to enlarge the sphincter is called as dash. Esophagomyotomy or Heller's procedure. A functional disorder of motility in the intestines is dash. Irritable bowel syndrome. An outpouching of the bowel, a vestige of embryonic development found on the ileum within 10 cm of the cecum is called as dash. Meckel's diverticulum. A partial or complete impairment of the forward flow of the intestinal contents is called as dash. Intestinal obstruction. The twisting of the bowel that occurs about a stationary focus in the abdominal cavity is called as dash. volvulus. The perianal varicose veins are called hemorrhoids. An abscess with the sinus tract seen at the base of the sacrum resulting from hairs that penetrate the skin is called pilonidal cyst. An ulceration or tear of the lining of the anal canal, usually the posterior wall, that occurs as a result of excessive tissue stretching and possibility from passage of a hard or large stool is dash anal fissure. The surgical repair of hernia is called as herniorrhaphy. The surgical procedure creating an opening between the colon and abdominal wall from where fecal matter pass is called colostomy. A temporary colostomy is usually placed at the midpoint of dash colon, transverse colon. A permanent colostomy is usually placed in dash colon, sigmoid colon. A surgical procedure in which a reservoir or pouch is created from the distal 45 cm of the ileum to store stool until it is drained by a nipple valve made from the intercepted portion of the ileum for treating ulcerative colitis is called cock pouch or continent ileostomy. A disease that spans the entire length of the colon and involves only the mucosa and submucosa with inflammation, edema, congestion and minute lacerations is called as ulcerative colitis. In appendicitis, pain is located midway between the right anterior superior iliac crest and the umbilicus, which is also called as dash point, McBurney's point. Ineffectual and painful straining to defecate is called dash tenesmus. The glycoprotein secreted on the glycocalyc surface of cells lining the GI tract and is normally produced in first and second trimester of fetal life is called carcinoembryonic antigen or CEA. A fecal calculus or stone is also called as fecalith. The amount of fluid present in the two-layered sac of peritoneum is 1.5 liter. A chronic relapsing disease that may develop in any segment of alimentary tract, typically involving the entire thickness of bowel wall, is dash Crohn's disease. The most common location of Crohn's disease is dash terminal ileum. An extreme dilation of a segment of the diseased colon seen in ulcerative colitis that results in complete obstruction is called as toxic megacolon. The type of hernia occurring at the site of a previous surgical incision that has healed inadequately is called as dash incisional hernia. The type of hernia occurring through the inguinal ring and follows spermatic cord via the inguinal canal is called dash inguinal hernia. The organism involved in food poisoning in fried rice is Bacillus cereus. Organism causing food poisoning in raw poultry, unpasteurized milk, untreated water, etc. is Campylobacter jejuni. Organism causing food poisoning in improperly canned fruits and vegetables is Clostridium botulinum. Organism causing food poisoning in shellfish is Vibrio parahemolyticus. Organism causing food poisoning in contaminated raw egg, unpasteurized dairy products, etc. is Salmonella. Thanks for watching. PSC NURSEന്റെ വീഡിയോകൾ ഇഷ്ടപ്പെടുന്നവർ ലൈക്ക് ചെയ്യുകയും അല്ലാത്തവർ ഡിസ്ലൈക്ക് ചെയ്യുകയും ചെയ്യുക. വീഡിയോ കാണുന്നവർ സബ്സ്ക്രൈബ് ചെയ്യാൻ ശ്രമിക്കുകയും ഫ്രണ്ട്സിന് ഷെയർ ചെയ്യുകയും ചെയ്യുക. നിങ്ങളുടെ വിലയേറിയ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുക. വീഡിയോ സബ്സ്ക്രൈബ് ചെയ്യുമ്പോൾ അതിനടുത്തുള്ളതായ ബെൽ ബട്ടൺ അമർത്തുന്നതിന് പ്രത്യേകം ശ്രദ്ധിക്കുക. എങ്കിൽ മാത്രമേ ഞങ്ങളുടെ വീഡിയോ അപ്ഡേറ്റുകൾ യഥാസമയം നിങ്ങൾക്ക് ലഭ്യമാവുകയുള്ളൂ. എല്ലാവർക്കും വിജയാശംസകൾ.